There's a moment every surgeon experiences. You're in clinic, maybe it's the OR, you're doing great work, but deep down you know, this doesn't feel like medicine anymore. It feels like manufacturing. Patients in, patients out, rooms flipping, notes flying, schedulers squeezing, admins pacing. This is assembly line medicine, and it didn't happen by accident. I'm Dr. Tyler Goldberg, and today we're talking about breaking down something every surgeon feels, but few can explain. How orthopedics, one of the highest skilled professions in the world, got reduced to being an assembly line. This didn't happen overnight. It was engineered piece by piece. 2 decades ago, hospitals became businesses first, care centers second. The metrics they use, they all changed. Throughput, revenue per room, time to turnover, OR utilization. How many of us have seen that stat? Cost per case, margin per encounter. Suddenly, patients weren't patients anymore. They were units of production. And surgeons? Well, we became the factory workers. Not because anyone hates surgeons, but because in a fee-for-service world, speed equals money. And once hospital executives realized that, the systems they built rewarded velocity above everything else. Around 2010 to 2015, healthcare leaders fell in love with a seductive idea. If we standardize everything, we'll save money. And to be fair, it worked for them. They standardized pre-op, they standardized post-op, they standardized implants, they standardized order sets, they standardized imaging for certain patients, they standardized timelines, discharge pathways, care maps, everything. And then they standardized what mattered most: our time, your individuality. It's too messy. Your craft, it's too slow. Your judgment, it's too variable. Your pace, it's too expensive. So they built a culture where the quickest surgeon is the one that's celebrated. The thoughtful surgeon is inefficient. The steady surgeon is not productive enough. That's how assembly line thinking became the default. You know, RVUs were supposed to level the playing field. Instead, they put every surgeon on the same conveyor belt with different speeds, the same direction, and the same end. Here's the unintended consequence of RVUs. RVUs turn surgeons into volume workers. You're not rewarded for wisdom anymore. You're rewarded for throughput. And once RVUs took over, clinic templates expanded. OR schedules became compressed, patient visits shortened, complexity was ignored, our time became devalued, craftsmanship was punished. The message became unmistakable. Do more, do it faster, and don't think about asking any questions. This is how a high-skill profession got flattened into a performance metric. And then came the final blow. The conversion factor dropped, and it dropped, and it dropped again. It's dropped so low it can't really drop again. The hospitals, they say, we can't pay you more. The payer said, we can't reimburse you more. CMS says, we need budget neutrality. So what was the only lever left? Volume. More RVUs, more moving parts, more people, more speed. And that's how a surgical profession became a treadmill. The system didn't reward excellence, it rewarded endurance. Assembly line medicine doesn't just hurt surgeons. Patients feel it too. Rush visits, 7-minute consults, no time for questions, no continuity. How many times have a patient said to you, I just want a surgeon that listens to me? Same script answers. The next patient is waiting energy. Outcomes for a patient that depend on luck instead of relationship. Patients aren't dumb. They can feel when you're drowning. I used to get the same review every month. Dr. Goldberg's a great surgeon, love him to death, great personality, too busy. Dr. Goldberg's a great surgeon, love him to death, too successful for his own britches. Too busy, too busy, too busy. And here's the truth we all know. A rushed surgeon is a dangerous surgeon. A burned out surgeon is an inconsistent surgeon. A pressured surgeon is a compromised surgeon. But the assembly line doesn't care. It just keeps moving right out from underneath us. You can't beat assembly line medicine by optimizing your workflow. You can't beat it by buying a new robot. You're not going to beat it by hiring another PA or compressing your template for how many patients you see. You can't beat it by learning epic shortcuts or automating all your notes with AI. Those are tactical fixes to a structural disease. The assembly line is the problem. The only answer is stepping off of it. You have to create a model where time returns back to you, where identity returns back to you, where craftsmanship returns back to you, where outcomes matter again to you and to your patients. Slowing down isn't necessarily being punished, where your attention can be valued, where patients are actually seen and heard. Imagine that. Surgeons are actually human too. This is why Concierge Orthopedics became the only feasible path forward for me, and why more surgeons are quietly stepping away from the line before it breaks them. That's NAOCA. It's for surgeons ready to step out of the grind. I'm Dr. Tyler Goldberg. Email me, founder at orthopedic-concierge.com. Tell me what the assembly line feels like in your world, one surgeon to another.